It's something most women worry about and hope it never happens to them. Pray it doesn't happen to them. A breast cancer diagnosis. CNN anchor Sara Sidner recently shared her stage 3 diagnosis on air, and she's urging other women to take the disease seriously. Listen.
If you happen to be a black woman, you are 41% more likely to die from breast cancer than your white counterparts. 41%. So to all my sisters, black and white and brown out there, please, for the love of God, get your mammograms every single year. Do your self-exams. Try to catch it before I did.
I mean, really, her message was incredibly compelling, emotional, but really it gives us an opportunity to have a conversation about this. So joining us now is oncologist Dr. Erika Hamilton. She's the director of breast cancer and gynecological cancer research at Sarah Cannon Research Institute. Thank you so much for joining us. You know, we just heard Sarah say it. 41% of black women are more likely to die from breast cancer than white women. It's shocking to hear. How is this possible?
Yeah, it's a really complicated issue, and unfortunately, there's not just one thing to fix it. It's really multifactorial. There are certain ethnicities that are more likely to have more aggressive forms of breast cancer. There's also access issues, access to screening, access to treatment. So definitely a multifactorial issue, but it's very important for women of all walks of life to realize how important screening and catching cancers early is.
You know, to that point, one of the things that we have found in our reporting is actually some level of confusion around when you're supposed to get screened. And we actually have some sound from one of the people we spoke with about this. Let's see if we can play it actually now.
We've actually heard from women in the community say because of these different screening guidelines, some organizations say start at age 40, others say start at age 45, some say have a mammogram every year, others say every other year. So it can be very confusing.
Doctor, why is it so confusing, and can you clear up the screening guidelines for us?
It is really confusing, and a variety of organizations have unfortunately made it very confusing. And I think that that has translated to women potentially getting the message that maybe mammograms aren't very important if we can't decide when people need to get them. And ultimately at Sarah Cannon, as well as in my clinic, I recommend mammograms starting at age 40, really at a minimum. We need to start talking to physicians, our physician, even as early as 25 about our individual risk characteristics, our family history, and whether 40 is a good age to start. And I do recommend yearly screening mammograms. Some of these recommendations really are based on mortality or people dying of breast cancer. And the reality is when you work in an oncology clinic that it's not just dying, it's also morbidity or really enabling people to have less treatment for their cancer and catching cancers early. And I think yearly mammograms are really important for that.
I did not know that. I did not know that it was based off of people dying instead of, okay, how many women are getting sick from this and at what age? I mean, that is a huge distinction there that you just shed light on. One question for you though, should the age for mammograms be lower than 40? Because we're seeing a growing number of cases of breast cancer in particular among patients as young as 20 years old through 40. What is your response to kind of those cases popping up more often than not?
Yeah, it is true. And most of the time, those people have unique risk factors. There's certain risk factors, such as knowing that maybe you have the hereditary BRCA1 or 2 gene that would change your screening recommendations. You would start mammograms sooner and may even add something like breast MRIs. There are other populations of patients that took certain medications that need to start earlier or had radiation as children. They need to start earlier as well. And so that's really why I recommend ask your physician what age is appropriate for you. 40 is kind of, you know, one generalizable rule of thumb, but really that decision can be personalized.
You know, one of the things you mentioned, risk factors, Sara said that breast cancer doesn't run in her family. She says she doesn't smoke. She says she rarely drinks. How are there still cases, though, where some of the factors, and maybe those aren't even the ones behind breast cancer, that they're not even at play, the markers that you would think, okay, I'm at higher risk, and you don't have those, what do you do?
Yeah, unfortunately, in 2023, you don't have to have breast cancer risk factors to get breast cancer. 1 in 8 women will have breast cancer at some point during their life. And so you think about how many women you have in your family, it is very likely that the 1 in 8 could just be that you're the first. There are risk factors. Obviously, older age is a risk factor, family history, genetic mutations such as BRCA1 and 2, the hereditary breast cancer gene. Dense breast tissue is one, and that is now mandated to be included on mammogram reports if you have dense breasts. And then there are also risk factors unlike those that you can change. Obesity, amount of physical activity you get, your alcohol consumption, taking estrogen supplementation or hormones. So again, a variety of risk factors that go into breast cancer.
Well, certainly I think that's important to hear. And also, you know, she, in sharing her diagnosis of stage 3, noted how it's not a death sentence anymore. And I think that's really important to also say, which is great news and a silver lining. I'll end on there. Dr. Erika Hamilton with the Sara Cannon Research Institute, thank you for joining us.
Thank you.